Good day everyone, and welcome to this video. Today we'll be taking a look at the SimPlant protocols. There are essentially two main types of SimPlant protocols to be followed. The first one is for partially edentulous cases, and the second one is for fully edentulous cases. Let's take a look at the partially edentulous cases. There are essentially three main pieces of information required to do guided surgery for partially edentulous patients. The first one is bone information, number two, teeth and soft tissue information for guide production, and three, the prosthetic information to perform proper planning. Now, each of these pieces of information have a few conditions that we'll overview right now. So starting off with number one, bone information. We first have to acquire DICOM data either from a CT scan or a CBCT. The main condition is that the scan needs to be done with an open bite of about 5 millimeters. And that's important because in step 2 and step 3, we'll need to merge an optical scan with that DICOM data. And the way we do this is that we use the teeth cusps as fiduciary markers in order to combine both. And so if the patient has a lot of dental work done, there will be a lot of scatter inside the cone beam. And so if the patient is in occlusion, we'll mask those teeth cusps. It'll be very challenging to merge the optical scan afterwards. An equally important condition is that the scan needs to be a full arch. And this is related to accuracy of the guide once again. So based on our research, when we're merging the optical scan to the cone beam, being able to use fiduciary markers that are far away from each other dramatically increases the accuracy of the guide. Moving on to number two, teeth and soft tissue information for guide production. In order to generate a guide, we require an optical scan of the patient's current teeth setup at time of implant placement. This can be done in two ways. Either you can pour up a model, a plaster cast model, and then send it to SimPlant, which will then be scanned, or you can optically scan the plaster cast model using an optical scanner and export it into an STL file. Alternatively, you can scan the patient's mouth with an intraoral scanner and then export out that file into an STL format. The second condition is for immediate extraction cases. For a plaster cast model, the teeth that were going to be extracted need to be shaved off on the cast first and then shipped to SimPlant or be optically scanned. For intraoral scans, the teeth will need to be digitally removed from the STL file. This can be done by SimPlant only for intraoral scans. Moving on to number three, prosthetic information for proper planning. There are two ways to bring in prosthetic information for partially edentulous cases. The first one is to have a wax up and then optically scan that wax up and export an STL file. The other way is to use the virtual teeth function inside the SimPlant software. It is our recommendation that for complex cases, for example free end cases or aesthetic zone cases, a wax-up be provided. For simpler cases where adjacent teeth are present and allow a decent estimate of the size of the teeth being replaced, virtual teeth is perfectly acceptable. Now let's move on to a fully edentulous case. One of the benefits of using the dual scan protocol is the fact that there is no longer need to duplicate a denture in barium sulfate to generate a guide. The patient's own denture can be used. Now, as its name states, the dual scan protocol requires two scans. The first one is of the patient plus the denture plus some radio-opaque markers and a bite registration. The second is the denture and the radio-opaque markers only. Following up with a few conditions, for scan number one, the bite registration needs to be radiolucent. One recommendation is to use Dentsply Regisil Rigid. Now for the second scan, what's important is that the denture must be metal free, or else we risk losing quality from degradation of the cone beam or the CT scan from the scatter. The other condition is that the prosthesis need to be representative of the desired aesthetics so that the implants can be well positioned. And finally, the denture needs to fit well. There should be no air gaps between the prosthesis and the mucosa. If there is, a mucosa-supported guide risks not fitting well. This concludes our video of SimPlant Protocol Explained. I hope you enjoyed it. This is Luc Charon, the SimPlant representative in Eastern Canada, signing off. Thank you.